Welcome to the Turn One Studio podcast. I'm Elliot Custodio, and here we sit with business professionals that we know and admire. We try to learn more about their businesses and a little bit about themselves. So with us today is Dr. Stephen Tartaglia, chiropractor in Elwood, New York.
East Northport, sometimes known as Elwood. There we are.
Fair enough. Welcome to the show.
Thank you for having me.
So, like I mentioned, Steve is a chiropractor, and what I've learned in my interactions with Dr. Steve over the years, there's a lot more to being a chiropractor than people think. It may sound naive, but I always assumed it was just a matter of cracking backs, as they say, and adjusting for certain discomfort. But there's more to it, isn't there?
Absolutely. When somebody presents an office, in my experience, the most important thing is getting a proper diagnosis. You can't treat somebody without knowing what's wrong. So the diagnosis comes from a very detailed history, physical examination, and many times imaging. And once we compile everything, we have a treatment plan. And yes, sometimes it is the manual adjustment or the cracking that we see, we all know about, or there's other types of treatments such as decompression, traction, flexion distraction, ultrasound, stim, myofascial release, laser, rehab exercises, whatever is best suited for the condition is how we decide our treatment.
Okay, so makes total sense. If I'm not feeling well, what symptoms should I look for that I should think, oh, Dr. Steve is someone I should reach out to versus someone else in the medical community? What, and I don't mean you specifically, we'll get to that in a minute, but a chiropractor in general.
Typically neck pain, back pain, lower back pain, headaches, shoulder pain, hip pain, gluteal pain, numbness, tingling going down your arms, your legs, just about any musculoskeletal pain.
Okay. So if I am feeling numbness or tingling, I should reach out to my chiropractor first, or am I thinking neurologist, or does that come after I see you?
It really depends.
Okay.
It can go either way. It depends how severe it is. Many times we don't require to see a neurologist. We make our diagnosis, and how most chiropractors practice like myself. If we have any questions on the severity of the condition, we will reach out and co-manage with a neurosurgical consult or a neurological consult.
I should have asked this at the beginning maybe, but how did you get started in this? What made you want to be a chiropractor?
Well, back in high school, I was playing high-level athletics, and when I was 16 years old, I was hit by a car as a pedestrian on a bicycle, and I was launched through the windshield, and I was basically in the ICU for 7 days.
Oh.
And it resulted in severe injuries to my ankle, my hip, my wrist, my head, and even though I recovered I had great physical therapy, great orthopedic, great neurologist, I really never fully recovered.
Okay.
And after that, I had headaches growing up. The headaches got worse. And when I decided to go pre-med, because I knew I wanted to go something in the healing arts because of how the providers helped me, I saw a chiropractor, and my migraines and headaches that I had daily resolved.
Wow.
And when I did my research, I liked the idea of holistic medicine, and that's why I went into being a chiropractor.
That's cool.
Yeah,
That's cool.
It was a good outcome.
Yeah, well, to be able to speak firsthand on how a chiropractor could change your life goes a long way.
Yeah, it was immense. I was the full-blown migraine spectrum every day, well, close to every day.
And how long have you had your practice?
1997. That's when we started.
1997.
Yeah,
All right.
I graduated in 1992. I worked as an associate in a very large office, and then we started our own practice.
Fantastic. Any particular type of patient? Oh, any age brackets you typically see more of than others, or?
What typical is, anywhere from 15 to 70,
okay.
80. But we treat very young to very old. Everybody's treated differently.
Is there I don't even know what I'm asking. Is there a pediatric chiropractic practice, or is that separate?
No, we incorporate it in our practice.
You can? Okay.
Yes. I've seen kids very, very, very young because they had seizures, and to try to manage that. Sometimes it comes from birth trauma in the neck, and we work on that. But typically, we do see pediatrics, but they're a little older than infants.
Okay. Fantastic. And I imagine you also specialize in athletic
Yes.
because of your situation.
Yes. When I was practicing as an associate, I was a team doctor for a track team.
Oh, very cool.
It was a lot of fun. I do like working with athletes. I coach travel ball and baseball and basketball. Yeah, I like working on athletes. I like working on any condition.
Okay. Yeah, that's cool. So tell me more about your practice.
Our practice is really, I think, kind of unique.
Mm-hmm.
How we started this. It's all diagnosis driven, and each room in my office is designed to treat a different condition.
Okay.
So,
What's an example?
if somebody has a herniated disc in the neck or a pinched nerve known as radiculopathy,
Okay.
my experience is typically herniated disc cases do better with spinal decompression and flexion distraction instead of the manual cracking adjustment,
Okay.
especially in initial phases. When I started practicing in 20 some odd years ago, I took part in a study. We did pre and post MRIs doing this therapy, and we showed over 80% of the cases the disc got smaller or resolved with that type of therapy. So that's one treatment room. We have one for the lower back, which is similar to do spinal decompression and flexion on the back.
Okay.
And then we have another table that has automatic flexion, which is for spinal stenosis patients who do better at just constantly bending and flexion. And then we can do manual adjustments. We have cold laser. We have all different types of techniques. So when somebody comes in, we try to diagnose what it is, what's the pain generator, and what's the best way to treat it. And we have an algorithm we follow. If it doesn't work, we deviate to the next step and the next step. And if we can't help, we will refer you out to somebody else. And we've been very successful doing that.
Fantastic. I don't want to lead the witness, but because I know you, I know that nutrition is also a significant part of your practice, no?
Yes. I've studied nutrition under a Dr. Seaman, an excellent nutritionist.
Mm-hmm.
And so we use nutrition in the practice, not only for general health and well-being, but to reduce inflammation.
Okay.
And one of the triggers is a lot of patients come in and they take Advil or Aleve or any other anti-inflammatory, and they relate to me that they feel somewhat better. And that tells me that the body is just producing too much inflammation. So by doing dietary changes, targeted supplementation, the whole approach is to reduce inflammation, which in turn will make them feel better. The other advantage is it will help overall health by reducing inflammation.
Makes sense. Are there any pearls of advice you can share to help people to avoid some of the common issues that people are coming to you with?
Number one, don't sit more than an hour at a time. Stand up, stretch. Sitting increases intradiscal pressure or stress on the disc, and it's is a major cause for lower back pain.
Okay.
Do not smoke. Besides heart disease and
Okay.
cancer, smoking is the number one predictive value by many sources for disc injuries.
Really?
Yep.
How come?
It decreases oxygen throughout your body,
Okay.
and the spine has very little blood flow to the disc. So when you have less oxygen, the collagen that's in the outside of the disc is not strong, and it leads to fatigue. That's what we think.
Well, that makes a lot of sense. Okay.
General exercise, just exercise 3 or 4 days a week,
So stay active.
and eat properly.
Yeah.
That's if I have a lot of friends who are physicians. If people just did basic things, we all wouldn't see so many people.
Right.
It's that easy.
Wow. What do you like to do for fun?
I love going to the theater. Love seeing music.
Okay.
Love playing pickleball and sports.
Okay. And that's huge these days,
Yeah,
pickleball.
going to the beach,
Mm-hmm.
hanging out with family.
Very nice.
Yeah, it's my fun.
So one thing that I love to talk about with entrepreneurs that have been successful for a long time, I forgot what the statistic is, but they say X% of businesses that start fail within like the first 2 years or something like that, right? So someone such as yourself who's been in business for a while, obviously you're successful. You weren't a victim to that statistic. What pieces of advice? This is a business question more than it is a chiropractic question. What pieces of advice would you share with entrepreneurs, either starting out or heck, even seasoned entrepreneurs, because we're always trying to learn something new?
Decrease your stress by not making yourself so big too soon.
Oh, okay.
So don't have such overhead that you can't support.
Okay.
So what worked for us was when we had no patients, we had one treatment room. and we had one treatment table which we bought used.
Okay.
And we made money and the practice grew, we added a second room, then a third room, then a fourth room, and we added a rehab room. But we did it in steps without taking debt.
Okay.
No debt, no stress. And that was
That's fantastic advice.
That's my advice, because like every business, even in healthcare, we have it webs and flows, patient volume. And if you have a lot of overhead and the flow goes down, that leads to stress.
Sure.
If you have low overhead, you have less stress.
Okay. And would you say, for anyone interested in the healing arts, that being a chiropractor is a path you'd recommend today?
It's a good path, but healthcare in itself is very tough. You have to want to do it to help people, because it's very hard to, as compared to other professions, you may not make as much money as you think based upon your education level.
I see.
So I do recommend it. It is very physical.
Okay.
So you're on your feet, 10 to 12 hours a day. I do recommend it, but you have to do it for the right reason.
That's fair. That's fair.
Yeah.
Well, you could say that about a lot of professions.
Exactly.
You really, if you're going to be spending a lot of hours doing it, you really have to enjoy it.
It's very rewarding, because your success rate's very high. So when you help people who are in pain or disabled and muscle weak, it's a very rewarding field. So,
wow, that sounds like
at night
it would be.
It feels you sleep well at night.
Terrific. Well, in the spirit of business and how we know each other through referrals and whatnot, what should we look out for when trying to find referrals to send your way? What are the triggers we should listen to with those that we interact with for us to say, I have the guy that you need to see?
Anybody that has the neck pain, back pain, numbness, tingling, shoulder pain, hip pain, all that. Besides that, someone is taking Advil every day, or I've gone to therapy or other doctors and I'm still feeling discomfort. I'm not getting the results I want. It's always good to do a second opinion as well.
Okay.
I'm very touchy with people taking Advil every day.
Okay.
And Aleve, it's just, you need to try to fix the problem.
Right.
And not mask it with the medicine.
Right. That is masking the issue. And for those that don't know, what's the specific concern with Advil on the body?
Advil affects your kidneys and it causes internal bleeding.
Serious.
So we know statistically, non-steroidal drugs could we think cause fatalities of 15 to 25,000 Americans a year.
Really?
From secondary causes. Tylenol affects your liver. So
okay, so that's a big deal.
Yeah.
How can people get a hold of you?
It's very simple. We have a phone number. It's 631-266-1391, and our email is northwoodchiropractic@yahoo.com.
All right, Steve, this was great. Thank you for coming by.
Thank you for having me. Have a good day.
Thank you, you too.